Pediatric COVID cases are on the rise in South Carolina. There are currently 36 children hospitalized with COVID-19 statewide. 16 are in the ICU, 6 are on a ventilator, 2 on life support. And a 17-year-old is among those currently staying in MUSC's PICU. The teen has been there for the last 3 weeks. He opened up about his month-long battle earlier today. Our Caroline Balchunas joins us live from the newsroom with how he's doing tonight. Caroline?
Well, Tessa, Christian Davila has been at Shawn Jenkins Children's Hospital for 3 weeks. He's only been awake for the last week and a half of it, but finally seems to be on the mend.
And then waking up in the hospital here, realizing I could barely walk.
1 month after contracting COVID-19, Christian Davila is still in the ICU battling the virus.
Right now I'm feeling better. Way better than I did, weeks ago.
1 week into the infection, the healthy 17-year-old went downhill fast.
He was incredibly ill when he came. He had to fly to us, and he has had very severe lung disease.
His father, Anthony, at his bedside, 150 miles from home.
This thing has chewed his lungs up to the point where they had to put him on the ventilator because he couldn't breathe. It affected his kidneys, it affected his liver.
It's been a life-changing experience for the whole family.
When we first heard about this COVID, I thought it was nothing serious, nothing more than just flu, media hype, whatever. But after watching what my son has gone through for the last month, it's totally changed my mind.
When one of my friends, when he heard I went in a hospital, he instantly went and get vaccinated. It scared him to death.
Christian has a long road ahead. He still struggles with breathing and can only walk a few steps at a time.
Right now, it's just physical therapy to get me back to 100% and working on my lungs again because COVID took all my stamina away.
Proudly showing off his vaccination card, Anthony says he wouldn't wish this on anyone.
I'm not going to say it's the cure to the world, but it will help. If it's going to keep my son from being in this position or any other child from being in this position, you need to do it. Seriously.
It's unclear when Christian will be able to go home. He says he is looking forward to sleeping in his own bed.
He says this is a very difficult and unprecedented situation, but he added that the way they're going about it here at 75 Calhoun Street may be one of the smartest ways possible.
Learning for all students is again our main concern.
The goal laid out today by CCSD leadership is to get to a point where there are maskless, full, and safe schools. But officials say to get there, mandatory masking now is a must.
Part of our responsibility is to do all we can to help prevent severe illness or death from COVID and reduce the number of students and staff who are forced to quarantine.
The problem with that up to this point has been State Budget Proviso 1.108. It states that no school district can use state funds to enforce one. Charleston School of Law professor Miller Sheely says using reserve funding may be a good strategy.
We're in enough a state of no man's land that this might have to get to the Supreme Court and find out. But on the face of it, it is a budget provision, and as long as they're not using the money, none of the funds can be withheld from them. So it looks like it's probably the most intelligent way for them to proceed with this right now.
While it's unclear how the state government may react, Professor Sheely says it may be difficult to stop this enforcement.
It's hard to tell in this environment. It's hard to tell what will happen. I would bet that it's going to be hard to get a judge to issue an injunction to say that, if you're not spending state money, that you can't require masking.
But in the end, Sheely says this is a situation where legal issues could be coming regardless of the decision.
And I'm sure that the school district is very concerned about teachers, employees, and students and parents maybe filing lawsuits if their children get sick or if teachers get sick. They have to worry about this from both ends. If I were counsel for them, I would worry more about my teachers and my students and my employees at this point.
Now, Sheely told me that one of the most foolproof ways he can think of for the state government to prevent boards from enforcing mask mandates would be to direct the Department of Education to tell boards that they can. The problem with that is that he says it's unclear if the Department of Education has that power. Yeah, Tessa, Allison Burgoyne says she suffers from occasional migraines that require her to get IVs for treatment. She says she's been going to an ER for help, and it usually takes her about an hour, but she says the trip she took last week opened her eyes to the reality of the problem for so many Lowcountry hospitals.
It was about 2 hours before I was even called into triage, and it was 5 hours before I was called back to a room.
An 8-hour ordeal from leaving home to getting back. And the things Allison Burgoyne says she saw in between were shocking.
You know, you see it on the news, you see the statistics, and you just don't know until you've actually been to the ER. There was people that, you know, had heart attack symptoms, and they sat there for 2 hours because they're at capacity. There's no beds.
That lack of beds isn't uncommon in local hospitals, and much of that blame sits on something medical professionals have been warning.
You know, when you go to an actual hospital to utilize a service, you can't get that service because they're at capacity. They can't treat you. They're full. They're treating COVID patients.
I asked the Lowcountry's 3 major hospital systems for their capacity numbers. All of MUSC, Roper St. Francis, and Trident Health told me they all had well over 100 patients with COVID, and MUSC says they've been over capacity for weeks.
We are in our third and I think the most dramatic surge in COVID-19 patients.
Roper St. Francis President and CEO Jeff DeLisi gave a candid update on the state of his hospitals at Tuesday night's Charleston City Council meeting.
When I go out to the front lines and visit our healthcare workers, they're tired, both physically and mentally exhausted from it. I mean, they're true heroes, and they're doing everything they can to take care of these patients. But the stress on our system and the other systems in the Lowcountry is really, it's pretty incredible.
According to Roper St. Francis and MUSC, more than 80% of their current COVID patients are unvaccinated from the virus. Despite these high numbers, hospital systems say they're doing everything they can to provide treatment to everyone who needs it. But for Burgoyne, she believes this trend can only be stopped if everyone works together.
You know, don't go to a hospital unless you absolutely have to. If you're not, you know, physically dying, you know, avoid it because they're full.
Now, I asked Burgoyne what she thinks is the best solution to keep more beds open in those hospitals. Her response to me was the same thing healthcare workers have been saying for months: get your COVID-19 vaccine.